So I'm going to go ahead and start our video here. Okay. Welcome everyone to our town hall. This is our discussion of challenges facing adolescents and their families in this era of social distancing. On behalf of the All One Foundation and the Autism Collaborative Centers for Excellence, I'd like to welcome you to our Town Hall series where we aim to provide support and encouragement to families who are managing very different stressors in light of the current pandemic. I do want to remind everyone that these presentations are being recorded, so if you wish to remain anonymous, please go ahead and log out and you can log back in freely under another name. Also, I want to emphasize that although this format is really not conducive to providing direct therapy on any one particular issue or to any one child, we do want it to be interactive to the extent possible. So please feel free to use the chat function or the Q&A to share your comments and questions. And with that, I'm very excited to have a special guest today to speak about the impact of COVID and some of the public health measures that are being implemented right now on adolescents, as this is a population that, in my view, is too often overlooked, especially in the autism community. We focus a lot on early intervention and early identification, and sometimes we forget that these kids grow up and they turn into adolescents. And I'm very excited to get some insight from Dr. Gabe Kuperminc, who is a professor of psychology and public health at Georgia State University in Atlanta. He chairs the university's interdisciplinary initiative on resilient youth, and the website I'm sure we can put up on our ACE Town Hall website if you're interested in getting more information on that. He also guides a statewide evaluation of Georgia's 21st century community learning centers. He's published extensively on the effects of parenting practices, school climate, and mentoring programs for at-risk youth. And he also directs a study abroad program for those of you overachievers who were here early. You heard us talking about his efforts to promote learning about human rights in Argentina. And he is actually sadly supposed to be heading south tomorrow, but has had that plan derailed. So with that, thank you, Dr. Kuperminc. And on behalf of the Autism Collaborative Centers for Excellence, welcome to our town hall.
Thanks for having me. I'm excited.
I expect everybody experiences adolescence slightly differently, but I'm hoping that you can talk to us briefly about some of the unique experiences that adolescents might be facing right now. I'll give a little bit of background on autism for those of our viewers who might not be very familiar. But to begin with, autism spectrum disorders are usually diagnosed in early childhood, but they're lifelong conditions, and for some, especially those without co-occurring intellectual disabilities, adolescence can really be a most difficult period of adjustment, primarily because, as you know, teens are exposed to increasingly complex social expectations. Teasing and bullying can become really torturous. And although some adaptive behaviors might improve with development and teaching, often we see repetitive behaviors and interests morph into other problems like eating disorders, obsessive compulsive behavior, and social withdrawal when peers don't share their interests. And as is the case for most teens, parents often find that adolescents with autism are less compliant and quicker to resist anything that parents might say or do. All this under normal circumstances, absent an international pandemic. So, Dr. Kuperminc, I'm hoping you can discuss a little bit about the term storm and stress and why that term is used in reference to adolescent development. What can we expect with regard to emotional volatility in this time?
Yeah. So, storm and stress has been kind of kind of like the topic of research and thinking on adolescent development ever since uh, they talk about G. Stanley Hall was one of the first psychologists to study adolescence, and his big thing was storm and stress. And the idea is that it's a period of time of a lot of, as you said, emotional volatility, issues with conflict in families with parents, and all of those kinds of things. And what's been really interesting about that um, research on that is that in some ways it's affirmed what all of us know and think we know about adolescence, that there is emotional volatility, there's different things going on, but has also debunked some of the beliefs and some of the things that we think we understand about adolescence. And maybe to me the best way of thinking about it is to realize that a lot of times we think storm and stress is all about the hormones, right? The hormones are raging, and that's making kids have higher highs and lower lows, and all of that. And while that might be part of it, there's also other things going on in development too. So there's the biological part, of course, but there's also cognitive changes. Kids are learning, young people are learning how to take each other's perspectives, so they understand more. When they're feeling some way, somebody else might be feeling a different way, or they can anticipate how other people are going to react in ways that they might not have been able to as younger children. And then also there's social changes that are going on, right? They're becoming more oriented towards peers. They're spending more time outside of the house, in school, in after school programs, in hanging out with friends, starting to date, maybe, all of those kinds of things. And all of those things kind of come together. And if you think about it, when you understand that other people have different perspectives than you, it might make you a little bit self-conscious, and that could contribute to changes in mood and things along those lines. I think the good news from all of this is that, yes, while it's a period of a lot of change and some storm and stress, it's also a period of a lot of opportunity, and a lot of times when young people are forming relationships with friends that are going to be lasting relationships and very deep, intimate relationships. And most of them are maintaining really strong relationships with their parents too. So it's not a time of breaking up with parents and shifting over to others. It's really a time of a lot of change that's hard in some ways, but really good in others.
That's what I wonder, especially with this social distancing, with the schools closed.
Yeah.
I think a lot of teenagers with autism really experience those changing social expectations, and they start to have more insight into the ways in which they are different from their peers.
Yeah.
That kind of can lead to some depression and anxiety. And I wonder if this is kind of a step back, kind of a relief, take a few minutes or a few months, maybe not necessarily a good thing, but take a little bit of a relief from the stress of interactions and maybe kind of reappraise the situation. I don't know.
You mean the social distancing as an
Yeah,
opportunity for that?
possibly.
I think it's really important. I know in my own experience with social distancing, I've learned about a lot of the ways that it's restricted things and made things difficult, but I've also learned about a lot of ways that it's created opportunities that weren't there before. And so, I think as
Right.
much as we can keep an open mind, but all that said, there's a huge variation in the kinds of access that people have to resources like good internet connections, a
Right.
computer you can rely on, a
Right.
webcam so you can look at each other, and those kinds of things.
Well, and that's the thing for students who can engage in Zoom meetings and Skype with their friends, it can provide a great structured ability to kind of practice those social skills. But for a lot of kids, those resources are absent. So that's really
Yeah.
unfortunate.
Yeah, and I think another thing to keep in mind with teenagers these days, I have a, she's not in the room right now, good, so I can talk about her. I have a 17-year-old, you know, and she's having her ups and downs in a lot of ways. But one of the things that she told me early on was, in some ways, this isn't that much of a change. You know, she spends a lot of her interaction with friends is done on her phone with, you know, texting and things like that. So if anything, she's increased the modes of communication with them because now she
Right.
can use Zoom and she can use some of the other things. That was early on. Now she's like, I am so over Zoom. If I can get away from
Now
Zoom,
she's
I would be happy. But
I think you're right, though, because a lot of students, especially really bright students who do well academically, um, are finding this to be an engaging time because they actually don't have to wait for the teachers to discipline and take care of all of those other issues that are going on in the classroom, but they can actually just do their work and learn and stay
yeah,
engaged. So it can be a real opportunity for learning there if they have the right tools.
yeah, you're thinking of that awesome op-ed that was in
Yeah,
the New York Times. There was an op-ed written in that was published in the New York Times last week by an eighth grader, a 13-year-old girl who was talking about the ways that social distancing has actually been an advantage, and she's been able to concentrate more, get more access to teachers, and learn more
mhm,
than she was, you know, in face-to-face classrooms
right.
where there were too many kids and too much behavior disruption and things along those lines. So yeah, so
But
there's
that does
plus.
depend on parents. I know for
Oh
my
yeah,
kids, the biggest barrier is us getting ourselves together to figure out when they're supposed to be online, what they're supposed to be doing, and keeping their schedules and
yeah,
prompting them every step of the way. So that's exhausting for
yeah,
sure.
yeah,
I also feel like we're just being initiated into the world of adolescence, but a lot of parents who rely on predictability, and a lot of parents with children with autism may have some symptoms of autism themselves, and appreciate predictability, can really struggle with the minute to minute fluctuations that you see. At least I see with my daughter, where one
yeah.
minute everything's fine, and then
Oh yeah.
apparently something has happened and I don't know what. But that can be really stressful as a parent even. And I know to kind of take a step back and, all right, it's not the end of the world. Something has happened. We'll get to the bottom of it. But for a lot of parents, it can be really unsettling.
Oh sure. Yeah, it's unsettling. I can't see it not being unsettling. You know, I somebody who like deals with, you know, uncertain schedules and things like that all the time, I find myself like writing down reams of notes and keeping track of things in ways that I never did before. And
Right.
even then I'm forgetting stuff and losing track of what day it is. And,
Oh my
you know,
gosh. Yes. I had a fear for the last 3 days that I was going to miss this town hall because I kept thinking, what day is it?
yeah,
So my next question is on resilience. A lot of research suggests that individuals with autism spectrum disorders are hyper responsive to even mildly stressful events. And you've done a lot of research on resilience. What can you tell us about resilience and how do we create resilience in our children, especially when we're kind of faced with all of a sudden
yeah,
big major stressor?
yeah. Well, and you can maybe tell me how much what I have to say relates to young people with autism or on the spectrum. One thing I always do to start out talking about resilience is to really back up and start with this idea that resilience isn't something that some people have and other people don't have. It's not like a super quality that some people have that allows them to overcome whatever. It really one of the you know, primary researchers in this field, Ann Maston, has written about resilience as being what she calls ordinary magic. And I love that phrase because what it tells us is that resilience is a really ordinary thing. All of us have the capacity for it, and all of us are able to overcome challenges. So part of it is that there's no resilience without challenge, right? If you're not challenged, what's there to be resilient to?
Right.
And, you know, and things like, you know, things like disability, like neurodiversity, like whatever, pose different sorts of challenges that you know, most of us are pretty good at figuring out and working around, right?
Mm-hmm.
Um, so so if it's an ordinary process, what does that mean? Well, it means that we have, you know, we have our sort of typical individual characteristics, things like, you know, ways that we come up with to cope with stress, our creativity, our adaptiveness and things like that. And everybody varies on those things, right?
Mm-hmm.
But the other thing that we have is support systems. So resilience thrives when there's supports around to help you, um, you know, to go to for information when you're stressed, to just reassure you, to be a place where you belong, where you feel like you're a part of it and that you matter. Um, and then and then even going beyond support systems like your family, like your school or whatever, is thinking about like, what are the ways in which whole communities are set up to support our well-being and our functioning. And so you start thinking about things like, you know, functioning schools, access to healthcare, infrastructure like roads to get you, you know, from where
Right.
you know, really, really basic things that if they're in place, it increases the likelihood that you'll be able to overcome challenges. So,
So maybe this challenge is an opportunity to practice and build up our resilience muscles a little bit as
yeah,
families and as a community.
yeah, and you know, support systems are kind of amazing things, right? Because one of the things that we know about support, social support, is that it's important to get it, but you get at least as much out of giving it to others as you do from getting it. One of the, you know, providing support to others in some ways is a very selfish act, right?
Right.
Because you feel really good after you know, give to a charity or spend some time volunteering or you know, do something kind for somebody that brightens their day, right?
That's a
So
very good point. Yeah. And it's hard to do that now. The random acts of kindness, a lot of them involve actually seeing another person. So that can be difficult
yeah,
to,
they do, and it's been, you know, hard and frustrating, but I've also seen really wonderful examples of people coming together even with social distancing. You know, I'm thinking about like the birthday parades
right.
outside of the kid's house, that, you know, with the balloons and honking horns and everything. In my neighborhood, my next door neighbor turned 13, and and his friends went all around the neighborhood leaving notes saying, "Hey, it's my friend's birthday. Would you put a sign out in front of your house or something?" And so the entire neighborhood just had signs that said "Happy Birthday, Charles" on his birthday. So when he got up and went outside, he just got surprised with,
Oh, that's wonderful.
right? So you know, there's ways that we're able to do that and connect even when we're not connecting.
Yeah, you just have to be a little bit more creative. That's
Hmm.
right. I think that's one of the real challenges with teens with autism, because many of them lack
Yeah.
either the motivation or the skills to really reach out. So it's effortful, and it's really tempting during this to kind of retreat to what's easy, and
Sure.
what's easy is withdrawing, staying in your room, um, playing video games, things like that. So I think that's a real challenge right now, is how to keep kids engaged in some way, even if it's not,
Yeah.
group interaction, but something that involves giving back to the community or interacting in some way.
Right. Well, when we talked about doing this, excuse me, with doing this town hall today and the connections with autism, of course, I hit the hit the library and started trying to find what I could find that was related to some of these things. And as you were saying, a lot of the literature you find on autism has to do with early intervention, early detection, and all of that. And I had a hard time finding very much about adolescence and about what are the social what's going on in their social development and so on. But the few things that I did find um, really reaffirmed things that I would have guessed, that probably most people who have experience with it know, is that although kids with autism may not have the same skills for social interaction and things like that, it doesn't mean they don't want it. They want friends. They thrive from having a peer network and social supports and those kinds of things. And so that's not any different. It's just how that looks and how they achieve it and how that functions can be different.
Yeah. I
And
think what's been really difficult in my work, I do a lot of social skill development with kids with autism, and we try to start much younger.
mhm,
But oftentimes we do see that kids, at least in the 5 to 10-year-old range, sometimes social relationships aren't that important. So to them,
mhm,
so they're not highly motivated. But then they hit middle school and high school, and they develop some insight into what they're missing, and
yeah,
that can be really difficult because they've kind of missed out on that opportunity coming up into adolescence to establish a background, a foundation of friends to come back to, or
yeah,
to establish some closeness with. So that can be really tricky. And
yeah.
then
So,
pressure.
so, and it's exacerbated by, being separated physically and, not
Right.
having so, I'm out of my range here with um, this, but I suspect that once again finding creative ways of doing things. That it seems like it's an opportunity for friends to reach out
Right.
to kids with autism because it's unlikely that it's going to happen, or it's less likely that it's going to happen the other way around. So that seems like an important thing. Another that just a guess would be that finding ways to connect young people around interests that they have. If they're really into gaming, for example, then gaming is a pretty social activity, as unitary, as lonely as it is in some ways. So
It can.
figuring out
Yeah. Uh-huh.
figuring out ways that you can sort of build on that
Right.
would seem to be a valuable kind of tool.
Absolutely. Well, here's one that applies to all kids with all kids who are adolescents. I'm a parent of a preteen who she occasionally tolerates my presence in her home. But what do parents do when adolescents are home all day, as they are right now, and want nothing to do with us? How hard do we push them to engage with us? Do we give them space?
Yeah.
As a parent, sometimes I don't know. I don't know what to do.
Well, let me know if you figure that one out. Um, it's hard. Again, I kind of come back to the question we started with about storm and stress. I think that some of those moments are going to be a little bit more intense
Right.
than they might be at other ages. But it doesn't mean that they don't they don't value you and don't want to be around you, just not right now and not in my face, and those kinds of things. And and as this wears on and gets longer, and the only 2 or 3 people you see every day are your parents, then um, it just gets to be more challenging to
Mm-hmm.
maintain that. I guess, so what do you do? One of them that one of the things that I think is, at least that I've tried to do, is back off as much as possible.
Yeah.
Right. But then also, try to find moments where something can be, special for them, like a food that they love, or an opportunity to do something that
Right.
they wouldn't do otherwise, or things like that. And even engaging them in this kind of, we're all in this together and we need to do something about keeping this house livable,
That
and
was going to be my next question.
right.
Household responsibilities. How much do we encourage them to clean up after themselves? Because my kids are making a big mess when they're home all day.
So am I.
Yeah.
Luckily you can't see like the floor behind me, but
Uh-huh.
but yeah, it, it's a really fascinating, this idea around family relationships and things like, and responsibilities is a fascinating topic that psychologists, anthropologists, sociologists have really studied a lot over the years. As psychologists, particularly clinically oriented ones, we often worry that when we give kids a lot of responsibility, that that it's it's somehow damaging to their development, right? That they're becoming adults before they're ready to be adults, kind
Right.
of thing. So that's been one of the threads of work through psychology. But in other fields, like in anthropology, um, probably one of the most famous anthropologists in her studies, Margaret Mead, um, studied development of teenage girls in Samoa, and really documented the ways that they contributed to their families, the ways that they contributed to their communities, and showed that they had relatively little of the storm and stress that we're talking about.
Yeah.
So there's one, sort of alternate view of it. Another one that has fascinated me, and it's kind of maybe relevant to our current situation, was a famous study of children who grew up during the Great Depression. And a sociologist named Glenn Elder um, followed a group of people who had been children during the Great Depression for 30 years afterwards, to sort of chart their life course, to see like what things happened or didn't. And one of the really fascinating findings from that work was that kids who went during the sort of intensive part of the Great Depression, when families were going through a lot of hardship, losing jobs and those kinds of things, kids who were able to help their families more at that time tended to have more positive adult outcomes
Really?
than the ones who didn't. And a lot of that had to do with age, right? So kids who were very, very young had worse outcomes than kids who were, maybe in their early teens when the Depression hit. Um, and so it sort of draws a link, saying that, you know, that particularly in difficult times, it may be that those ways that young people are able to contribute in meaningful ways to their families. So whether it be, in that case, it was things like going out and earning money, or doing things to support the family. But I would think that it extends to other things that feel meaningful. It isn't just chores because mom said you have to do them, but things that really make a difference and that they can see as being meaningful and valuable parts of family life.
Makes a lot of sense from a self-efficacy, self-confidence perspectives, things
Yeah,
that tie them into being integral parts of the family.
yeah. And in my own research, I've studied that as part of trying to understand adolescent development in immigrant families, because you know I've seen a lot in those families that young people are put in the position of doing, you know, more things for the family than we typically think of or expect of, you know, kids in the U.S. Things like cooking and cleaning, things like caring for younger siblings, and then other things like translating documents for their parents who don't speak English as well as they do, and things along those lines. And so we've done a lot of work trying to understand what are the implications of those kinds of responsibilities for young people's development. And this started from that sort of clinical psychology perspective of, oh no, we are, you know, adultifying these kids, and how bad is that going to be? And what we found was that it isn't so much the amount of responsibility they have, and I'm talking about within sort of normative ranges. I'm not talking about, you know, send them out to the coal mines. I'm
No
talking
child
about,
labor.
right, that it isn't so much the amount of responsibility, but how it's distributed and how it's acknowledged, and whether it feels fair or overwhelming to the young people that makes a difference for mental health. So when kids feel overwhelmed and feel like their parents aren't recognizing what they're doing, that's when we see higher uh, more symptoms of depression and anxiety and things along those lines. On the other hand, we know from, you know, data from these kids' teachers that the young people who have more responsibility at home are viewed by their teachers as being more socially skilled, more mature, more competent in a lot of different ways than other kids who aren't doing as much around the house. So again, it seems like there's some benefit to responsibility, and I think the trick is it needs to be meaningful and it needs to be fair.
That makes all the sense in the world. Responsibility is not a bad thing, but I definitely know anecdotally from my own family, if my son is doing something and he doesn't see my daughter doing something equivalent, that's a problem.
Yeah, yeah.
But it is hard, especially right now. My husband said that he wants to lock the kids out of their room, and he wants to run the house like it's a farm. You know, give them chores, give them all the jobs to do.
Mm-hmm.
We discuss how, and we feel really old because we talk about how when I was a kid we did all this stuff, and I did all my own laundry, and I had to clean the bathroom. So there's definitely an art to how much, how soon. Maybe we need to fade up the responsibilities a little bit.
Yeah, I
Careful.
don't know. Well, if you figure that one out, I study it, but I don't do it good.
No, we don't
As a
either.
parent.
And then we complain about it and we sound like we're geriatric.
Yeah.
Well, let me ask you about, you talked about community supports and school
Mm-hmm.
supports and contributing to resilience. And I know a lot of your work has been working with mentoring programs for youth
Mm-hmm.
from disadvantaged backgrounds. Do you know if any of these programs are trying to move to online delivery systems, or how they may be reaching out to kids and teens right now?
An awful lot. Well, an awful lot, and also, you know, they're struggling to kind of get it moving and get it online and whatever. There's been for a number of years. There's okay. For a number of years, there's been a lot of work developing around what's been called e-mentoring, so electronic mentoring. And so these days, a lot of it is happening on things like Zoom. Um, and so, the good news about that is that there was already some research behind it and some practice behind it, so that there are reasonably good resources on, if you want to do this, how do you do it, and what are some of the things to look out for, and what are some of the best practices, and those kinds of things. And um, there's a wonderful organization called the National Mentoring Partnership. It's they for short, it's mentor, all in capital letters, and their website is mentoring.org. And if you just go there and search coronavirus, you'll find all kinds of resources that they've made available for programs and others who want to do mentoring in that context. It's really an amazing resource that they were ready to put up when this happened, because they'd already been had their thumb on all of the research that was going on in that area. So that's a really great resource. So there are programs all over the country, really, that are figuring out ways to do this. I think it's hugely variable in how much it's happening and how well it's happening. So this isn't mentoring per se, but one of the projects I'm working on, I think you mentioned, is helping Georgia enhance their evaluation of their after-school programs, the 21st Century Community Learning Centers program. And so Georgia kind of administers something like 130, 140 grants all over the state. And these grantees each operate anywhere from 1 to 20 programs in their area, right? So we're talking about hundreds of after-school programs all over the state. And last I heard, about 15 of them are doing virtual programming. So,
Oh, wow.
2 months in. So I think there's more that's going on than that, but that's what the state, was able to tell us they have information about. And one of the things that we're hoping to do with since we've had to pivot from a lot of the work we were doing to something that's meaningful and useful now, is we're gonna try to collect some information from kids about what that experience is like. What are the things that are working and not working, and is this helping to be able to have access to those things? And then also just surveying programs to ask them, what are you doing? Where did you get these resources? How are you using them? How much programming are you doing? What's not working? What is working? Those kinds of things. So there's a lot we don't know.
Program evaluation.
Yeah, yeah, yeah. So yeah. So the answer is really mixed. It's happening. It's not happening nearly as much as any of us would like, and it's really concerning that something that I think is a really big part of kids' days, but also a big part of parents' days too, right? I mean, one of the things we don't think about as much with after school programming is how much of a support that is for working parents.
Oh, I think about it.
I bet you think about it.
I've got 4 of them. I definitely think about that frequently.
Yeah, yeah, and so so the role that it plays in providing a bit of relief to parents, I think, is a big thing. And so after school programs, but also mentoring. Mentoring is has a lot of potential and a lot of ability to provide kind of a different set of support and a different set of guidance than what parents are able to do. But it's challenged with this, with social distancing.
It's interesting, though. I wonder, since you bring up the mentor network, that if that's an opportunity for older individuals, young adults, even on the spectrum, to reach out to be of service to younger kids and teens. I don't know
Yeah.
if it's something that would be helpful,
Yeah.
but certainly an opportunity.
I don't know a lot about that, but I think I shared a couple of resources with you that are specifically about mentoring with young people on the spectrum.
Mhm.
Um, and again, I don't know a whole lot about it, but I do recall one program that I read about with huge interest was a program for children with disabilities. I think they had spina bifida,
Mhm.
and the the mentoring was done online, and it was done. The mentors were all older teens or young adults who also had the same disabilities,
Right.
working with groups of kids, and it was a wildly successful program that,
Powerful.
yeah, and it addressed, the issue that those young people had with mobility. They couldn't get around as much, and so, an online format made a lot of sense.
Mhm.
Um, and so, I suspect that some of the same kind of stuff could work with young people on the spectrum, and goes back to the point that I made before too, that helping others is a really great way to help yourself, right? I mean, it's a really great
Right.
way
Right.
of
Well, and especially with adolescents who are, in my experience, are often hesitant to take advice from anybody who doesn't understand what it's like to be
mhm.
them.
Yeah,
um,
yeah,
somebody who has actually been in similar shoes may be able to speak to them in a way that other adults can't.
yeah, and there's been a lot of work with different ways of doing mentoring, and so there's a lot of work on mentoring when the mentors are really only a little older
Mhm.
than the kids who are being mentored.
Right.
And sometimes you sort of like layer it, right? So there's the little kids getting mentored by slightly older kids who are
Mhm.
getting mentored by adults.
Right.
Um, and that can set up a really nice system. And then, even another approach uh, that I think you hinted at was having older adults as mentors. So people who are maybe retired and have more time on their
Mhm.
hands and want to do that. So this kind of more intergenerational kind of thing has also been a really effective and successful approach.
Mhm.
And actually, there is a group. I don't know if they're still doing it, but it's a group in out of Pennsylvania that developed a model. I think based at Temple University.
Okay. Look into that. And we'll put these resources on the website so people can access them for different mentoring sites
Yeah. Oh, that program was called Across Ages.
across ages.
Yeah.
Okay, great. We also have a summer program that I'll go ahead and plug that we're developing. We got a grant through the All One Foundation, actually, to run a summer camp for youth with autism and related disabilities. And we're moving online, as is everyone.
Yeah.
So it's going to be interesting to have an online camp, but we're going to make it work.
Yeah.
Um,
I'd love to hear about how that works and what kinds of things you do.
I'm eager to see how I figure it out myself.
Yeah.
Um, so another, I know a big part of your work is working with Latino youth and other at-risk populations. There are so many ways that public health interacts with demographic
Hmm.
factors, access to healthcare, language, you mentioned, the finances, parents who need childcare. What do you think, what concerns you the most about how we're handling COVID and how it's likely to affect adolescents who are already at risk due to some of these barriers, systemic
Yeah.
barriers?
Well, what concerns me the most is the huge gap that there is between kids who have access to resources and kids who don't.
Mhm.
And one thing that this pandemic has done in our society is really laid bare the the disparities that really exist in all sorts of things. Starting with internet access and access to computers and things along those lines, but to healthcare, to um, food and shelter and all of those kinds of things. And then the disparities in who's who, you know, who is the essential workers that need to be out there delivering our Amazon packages and
Right.
working in the grocery stores and putting themselves at risk all the time, and then going home to, you know, many times houses where it's hard to isolate from one another if you've been exposed and somebody else hasn't, and those kinds of things. So those disparities are the things that concern me the most, um, and the sort of you know, without getting too political here, just what feels like not enough being done to try to acknowledge them or address them.
Right. Yeah, I do wonder when schools do open back up, I think a lot of students will have had several months worth, or depending how long this goes, of homeschooling. And some will have been very much in a holding pattern
Mhm.
and be right where they were, if not a bit worse off than when they left school. So it's
Yeah,
definitely going to be a challenge for educators.
it is. And, you know, I also see opportunities there if we were to invest in, you know, the things that we need to do to catch up for our kids and for our communities.
Oh, I
Um,
hope so.
yeah,
So, some mentoring networks, hopefully.
yeah.
Um, well, with regard to your research, do you think that this is likely to kind of change how you measure youth outcomes, how you what the goalposts are for measuring risk and resilience and adolescent development?
I don't know that it'll change what we measure in terms of outcomes. It may change, you know, how we think about risk, in the sense that you know everybody has experienced this risk
Hmm.
of of you know exposure to a pandemic and things like that, and the way that we're exposed to it differs, as we were just talking about, and the ways that we're able to respond differ. And so I think, you know, as a researcher, again, I think there's some real opportunities to understand that. I got off a call earlier today where we were, I'm part of a group that's been studying the ways that communities come together to collaborate around solving problems for children and families in their communities. And you know, one of the things that we're trying to study is what do these networks of collaboration look like? And I'm talking about how people in schools talk to people in social services, talk to people in government, talk to people in religious organizations and businesses and things like that. And you know, I think that what we've seen in other situations is that when communities have more of those kinds of connections and use them in everyday life, that those are the ones that recover
Hmm.
most effectively and best. So, um, you know, in Georgia, just a couple of years ago, when we had Hurricane Michael devastated a lot of the communities in southern Georgia, this statewide network of collaboration was able to mobilize all kinds of resources to go down there and start getting food and basic supplies to communities a lot more quickly than they would have if it hadn't been in place already. So you know, I think one thing that might change, that I hope would change, is more of a recognition of the ways that all of these different elements of our communities are connected,
Hmm.
and how you know letting one kind of wither really affects the whole community. So it isn't, you know, oh, too bad this group doesn't have this resource. That group not having the resource affects all the ones that do have the resource.
Right.
And I think, you know, learning more about those kinds of things could be something that changes, or at least I hope changes.
It's certainly a big opportunity for some systemic change to hopefully build up some supports that will
Yeah.
have lasting consequences for adolescents and families. So, well, with that, I think we have actually gone over time. So thank you so much for being here and sharing your insights into adolescent development.
Oh, it was a pleasure. Thank you so much for inviting me.
Yes, and hopefully we can do it again very soon. And I I would love to send you a postcard from somewhere to make you feel like you're on the beach in Argentina, but
Yes.
no such luck.
No such luck.
You
All
send me
right.
a postcard when you finally do make it there.
Yep, I'll do that.
All right. Thank you so much, Dr. Kuperminc.
Thank you, Dana. All right. Bye-bye.
All right. Thank you.